Doreen, welcome.
Sorry, I had a little Zoom challenge. My bad.
That's okay. No worries. We're so glad you're here. Right. So I guess we can just welcome everybody. So thank you so much for being here today. My name is Hattie Stigum Larionov. I work for Peace Northwest as a Clark County Parent Coalition Program Manager. And this is Doreen Vandervoort from DDA. She will be presenting today and taking our questions, and hopefully she'll have all the answers for us. So Doreen, I'll let you go ahead and take it away.
Oh, I would never claim to have all the answers, but I'm certainly here to do my best to help you guys, particularly around the question of changes to the DDA enrollment process and how that is looking different after the October 7th WAC changes, because it's fundamentally changed who our clients are and who will be serving. Um, and hopefully made it easier for people to access DDA programs and services. So I have a PowerPoint. Is that helpful, Hetty? Okay, great. I always check with my crowd. Are you more of a tell me your questions and then I'll give you answers, folks, or do you want like a formal presentation? So I am too many windows open. So let me just get the PowerPoint going here. Do you ever have that situation when you have like 25 windows open and then none of them want to close when you need them to?
All the time.
All the time.
Never
Okay, good.
happens to me.
I'm so glad I'm not alone. Well, I'll tell you a little bit about me. So my name's Doreen Vandervoort. I've been a disability social worker in Washington since about 2004. I've held probably every kind of disability service job you could have, from like direct care, job coaching. I've been a case manager, I've been a resource manager, I've been a administrative hearings coordinator, I've done adults residential, I've done children's caseload. Um, I am a parent of my daughter passed away this past year, but she was a client of DDA up and until her passing. And she was not your typical DDA approved kiddo because she had spina bifida, and that's one of those conditions that doesn't always result in intellectual and adaptive functioning deficits. So when I went home to take care of her for the first 10 years of her life, I also picked up the job as a self-advocacy director and helped the Self-Advocates of Washington rejoin People First. And then I became a parent-to-parent coordinator, which is where I met maybe a lot of you guys in my role at PAVE, helping with the parent-to-parent program there and doing training and um, information development for the Parent Center and the PAVE programs while I was there. I came back to the state in 2022 and was one of the first no paid services case managers doing initial assessments for this region. And Region 3 covers the 12 counties in Southwest Washington. So all of you guys and all the counties in the South, plus everything east of the mountains, west to the water, and north to Pierce and Clallam. So it's about 13 counties total because we share Skamania with Region 1 a little bit. But the rest of our team kind of covers that whole area. So I am going to share screen now. I think the PowerPoint will show. You guys seeing that?
Yes, I do.
Hooray! Okay, perfect. So this is the formal training that was put together by our psychologist. His name is Dr. Benjamin Thomas, and he is the intake and eligibility specialist and psych who rewrote the Washington Administrative Code in response to House Bill 2008, which was the legislative direction DDA got to be the first state in the nation to remove full-scale IQ as a requirement for DD enrollment. So we are the first state to do this. Lots of people watching us to see how this plays out. Super not fun to expand enrollment and then hit a budget crisis. Not how we hoped that would go, but we will see what this year brings. And thank you if you go and advocate for services and clients. So the RCW has not changed fundamentally, except for 2 years ago, we had another House Bill 1407 that did away with the ability for the state to do an eligibility review prior to the age of 18. So we no longer have what's called a 10-year-old review for state DD enrollment. So we're not going to be prompting families or people who have been enrolled to go get evaluation and adaptive functioning tests anymore before they turn 10. What that means is that it puts more of that burden onto the family to get those evaluations and documentation done if they want to maintain a home and community-based waiver, because the federal government will still do their reviews. We don't have any control over them. So they will still be looking for categories besides developmental delay after the age of 10. But our state now will no longer look at eligibility from the time that a person is eligible at age 4 until their 20th birthday. So somebody could become eligible under the category of developmental delay now, and that will extend all the way till their 20th birthday. So the Washington Administrative Code chapter is 388823. So this is the main chapter of WAC that oversees the intake process for DDA. It also establishes things like client rights, residency requirements, and stuff like that. So that's all inside this chapter. It used to be about 48 pages. Now it's 26. So a lot less to read. If you like policy, it's a great thing to dig into. Our basic determination process has not fundamentally changed, just the documentation that we require. So our application is still the same. The most important things about a DD application is that it's filled out completely, which means there's something written in every box on this PDF. Because we use this to create what we call our care profile. And that is how we create a person inside of our system and connect them to provider one and all the other lovely places. Is we have to have these demographic questions answered. It helps us to find out if they already exist in a system within DSHS or the state somewhere. And then we connect those profiles together using things like date of birth and social security number. So it's important to write something in every box, even if the answer is not applicable or something really obvious like I speak English. I want my language, my written information in English, so that we can make sure that we're meeting the accommodation needs of everyone, and not making assumptions about people's preferred languages and things like that. So it has been expanded in size a little bit because we needed to meet accessibility requirements under the federal laws for all electronic documentation. And so it's back onto 2 pages because the typing was too small to meet accessibility requirements on the previous app. So page 1 primarily focuses on the applicant, which is the person with disabilities. So the child's name or the adult with disabilities name, information about how to contact them, where they've attended school, why the person with disability is applying for DDA, what their disability is, and then underneath this next blue line is the representative information. This is where you're going to put the necessary supplemental accommodation contact. So that's parents, could be a social worker from DCYF, whoever's kind of the legal decision maker for that person. We do want everyone to have a representative. It's not a requirement to apply, but the implication in applying for DDA is that you have some accommodation and support needs, and that we want to have another person to contact and connect with in order to be able to help you access services and get records and have that history, if that's possible. You can list up to 3 representatives on this application. So your primary NSA could go here, and then you could add additional parents or other, foster parents, other roles. If it's a DCYF client, the social worker information would go into the representative area, and then foster parents and other people would go into these other roles. And then for signatures, anyone who is 18 years, 1 day old signs their own application. And if they don't sign their own application, we cannot process it. They are legally free adults, able to make their own decisions until a court says otherwise. So capacity is not determined by a doctor or a parent. It's determined by a court. And so parents need to have their adult young people co-sign applications and documentation with them. I will not be able to get records if it's not co-signed.
So, Doreen, this is Darla. So
I don't.
thanks for coming. If there's a guardianship in place,
Then
then,
parent can sign, and then they need to produce the court document that gives them the right to sign on behalf of the person.
okay, thank you.
Yeah, so they can turn in court documents that go with this, and we'll accept that signature, but we have to have the court document with the application. The same is true for the consent form, except a little caveat on the consent is that in Washington State, minors who are 13 and over have to consent to the disclosure of their mental health documentation. Why won't it open? It's frustrating me, sorry. So this is the DSHS consent form. I don't have any control to change it. I would if I could. It is for all DSHS agencies, so it's not a DDA specific consent. Some of the important things is that the person who the records are about, so the applicant, the child, the person with disability, is the client identifying information at the top of these. For a consent form, you have to check the box and write the name of the place that has your records. So Dr. Thomas doesn't actually help me get you records. Like, I need to know that he works at the Vancouver clinic, or that he is an OHS, he works for the OHSU system. They're who's going to produce records to the DDA. We oftentimes will see these left completely blank, and then no records turned in. That starts what I call the very long game of phone tag with the parent or family member to get them to sign a consent that actually allows us to get records. When these are blank, I can do nothing with them. No one will give me any records because they're not named on the consent. And then I have nothing to work for or with as far as documentation. And so these people are often declined for eligibility for insufficient information because they haven't produced records and they haven't produced the name of any place where I can get records. So that was probably the most common reason somebody's denied DDA enrollment, is that we do not have records and we don't have consent to get them. So healthcare providers, you want to list their big organizations like OHSU, Seattle Children's, Dornbachers, Swedish, Multicare, Vancouver Clinic, Smart Team, right? So then I can talk to all the members of the Smart Team. This is the way to make sure that I can get the most information from the highest variety of people. Also, if someone produces a document in here, but I need something like a statement of stability, this gives me permission to talk to anybody within that health system, so that I could go and get additional information to try and help someone get enrolled. So the other thing that we want is for this box for school districts to be checked and for the district to be named, not the elementary school, not the teacher's name, because mostly we are not looking for IEP documents. We're looking for the school evaluation that was done by the school psychologist that contains testing and scores from the school psych, the physical therapist, the occupational therapist, the behavior specialist. During that 3-year evaluation, they're typically doing standardized testing. That's what the state is looking for adaptive function deficits for people to ensure that they meet our state standard for functional limitations. And then we got to have a box check for continuity of care. They can limit what records they want me to see or have. I've had people who write in things like mental health care information, except, gender identifying treatments, right? They can limit this consent however they want to. if that happens, I may then be coming back to the parent or family for records that were not disclosable to me from the agency. For everyone, if you want me to be able to get a psychological or neuropsychological evaluation, this mental health box has to be checked. Otherwise, they won't give me those evaluation documents. These are specially protected records. And so if you want us to be able to get the records that typically diagnose an intellectual disability or an autism spectrum disorder, they are considered a mental health document. And then signature, this would be for a client signature. So anyone with a teen in their age needs to sign their own consent, or I will not get access to mental health records. They'll give me everything else. They will not give me those neuropsych evals. And then parent, if they are the legal parent or other representative with court documents. And then you got to check the box down here. What is your role? I'm either the parent, I'm the legal guardian, and I've attached a court order. I'm a personal representative. I'll be looking for like a DPOA or some other legal document in that case. A durable power of attorney document. I'm trying not to use acronyms. I'm sorry. And so that's what might be listed there. And there is in the tiny print instructions about what to put in each of the boxes and how to use this consent. That comes with every DDA piece of paperwork that comes out of DSHS. There's always going to be an instruction list. Most people ignore these. They don't read the fine print. And then I have incomplete documents. Okay, any question about those two forms? Because they're pretty core to helping people get enrolled. Nope. Okay, awesome. So the next thing I'm going to show you guys is this required documentation for DD enrollment. This was just updated with the new information. So this is that lovely, pretty, colorful form. You guys don't want to see all that. You just want to see this. That lovely, pretty, colorful form that outlines what are our conditions, who is the diagnostician will accept them from, and what are the substantial limitations we're looking for. So developmental delay is our broadest category, and it includes all children 0 to 20 years old. This category will expire on people's 20th birthday. And so if they don't reapply when we send them letters at 19 and we don't get new evidence of one of the other lifelong conditions, they will expire on their 20th birthday without appeal rights and lose all of their services. So it's pretty important when we get those notices, we do that. So in Region 3, I can't speak for everyone else, I've moved the notice date back to the 19th birthday. So everyone is getting a letter and a consent form on their 19th birthday saying your eligibility is being reviewed and beginning the process to start working on gathering that evidence and documentation so that we can get them re-enrolled and get the evidence we need prior to their 20th birthday. They'll also get a planned action notice 90 days from their 20th birthday telling them you are either expiring or you are in review and you haven't produced documentation.
So Doreen, this is Darla again.
Yep.
And I think you said this, I just want to make sure I heard it correct. So
Sure.
DDA is no longer sending anything prior to the 18th birthday that reminds parents they have to get all of that documentation on a permanent developmental disability prior to the 18th birthday to be eligible.
That is correct. The first time that we're going to tell them, hey, you got to go get this documentation and new adaptives from us is going to be when the month they turn 19.
Okay,
They may get reviews from the federal program. If they're on a home and community-based waiver, they're on an Apple Health program. There's going to be reviews that happen from the federal financial teams and the federal Social Security teams. That is not from DDA Washington State.
Okay, thank you.
And So developmental delay is a broad category. It expanded from being only till age 10 now to being keeping people enrolled till age 20. Intellectual disability is a lifelong condition. It has to be diagnosed by a psychologist or a school psych. A lot of times we see people come from out of state and they have diagnoses by medical doctors or PAs or ARNPs. This diagnosis, as a rule, requires cognitive and adaptive testing that really can only be administered by a licensed psych or a certified psych. And so Washington State requires this diagnosis to be given by one of those professionals. Has to be documented in a report and has to have an adaptive skills test with a composite score of 69 or below within the last 36 months. So you're going to hear me say that a bunch of different times because that's also the standard for epilepsy, for autism, and for another neurological and other condition. So what that means is that we're looking for a score of 69 or below on one of these adaptive tests. If someone doesn't have an adaptive test and has no access to adaptive testing from the last 36 months, my team will offer them what's called an inventory for client and agency planning. That's an adaptive that DDA staff offer. I think we did 120 in all of last year. And since October, we've done 127. So it definitely changes the rule. In order to be offered an ICAP, you have to have a qualifying diagnosis in your records from an appropriate diagnostician. So if we have an evaluation of autism, a qualifying diagnosis, but the person has no adaptive testing and no access to adaptive testing from the last 36 months, then my team will offer what's called the ICAP. Any questions about that? These other adaptives are the approved adaptives. The DABS was just added. This is the one from AAID, who also authors our SIS. They're very commonly used among SICs, neurodevelopmental teams, OTs, PTs, BCBAs. Lots of people can do these tests. They're the most common tools used within schools because they look at all 5 areas of development. And that can be very useful also for a developmental delay category. So let's say we have a kiddo who's got an autism diagnosis and a composite score of 71. Darn it, they just missed the cutoff for a composite score that would qualify them under autism. We can use the breakdown under the 5 areas to look for that developmental delay category because you only have to have 3 areas of a 25% delay or more to qualify under dev delay. So that's like really getting into the weeds. I don't want to go that deep with you guys, but it is important when you're helping families get documents or you're helping them advocate for a plan or an evaluation with their schools, that you ask for the psychologist to produce what we call the practicals. I just say the bell curve with all the numbers and all the percentages and all the standard scores and T-scores. If that doesn't come in and there is an indication that someone is borderline and we have consent, we'll go back out to that psych and ask for it ourselves. But if to the best of our abilities, we can help families and individuals understand that that should be a part of their academic planning. If they have adaptive testing or they have any kind of adaptive deficit, it's a great way to measure meaningful progress. It's good information overall, gives information about communication, motor skills, social, emotional behavior, communication, and cognitive academics. So it's really a great composite look at the needs of a student. And it's done by asking the teacher to do a questionnaire and asking the parent or family to do, or caregiver to do a questionnaire. And they fill those out about what the student does well, needs support with, etc. And that is how the composite scores are come to. So somebody who's 5 might score high on an adaptive assessment because they're being measured against 5-year-olds. And at 7, they may score fundamentally lower because the expectations of a 7-year-old are higher than that of a 5-year-old. So being told you don't have a qualifying adaptive score today doesn't mean you won't 18 months, 2 years, or 3 years from now. So that doesn't mean that you're never eligible again. And anyone can reapply at any time with new information. So then our other categories, the one that doesn't require any adaptive assessment is cerebral palsy. And this has been expanded. So it's cerebral palsy or other brain damage, which causes a full or partial limb paralysis. So no more requirement for it to have a specific diagnostic label for the paralysis. As long as there is a condition that is cerebral damage in nature that is causing a paralysis, and that is given by a physician on the list, then we're just looking for evidence of direct physical support in 2 or more areas daily. And so that can be done using the CARE tool. That can be done by a doctor writing it into a note. That can be done through evidence of from a school evaluation or a therapy evaluation. So this is really helpful for those individuals who potentially have neurological conditions that have resulted in physical limitations. And now it doesn't require it to be multiple limbs or have a severity that requires a diagnostic label, just any type of paralysis. And those are being looked at pretty closely to see if there's still other conditions that need to be included in there. Because currently it leaves out like non-brain conditions that are related to like bones and connective tissues and things like that. So never hurts to apply, because more information that we get, we can pass those up to central office and other folks who are looking at the rule to make sure that we're being inclusive of the intended developmental disability clientele. Most of the time we can get to developmental delay with those guys though. Okay. So after you are enrolled with DDA, you are entitled to what? Anybody have an answer for that?
Personal care? Nope.
I don't think you're entitled to anything. You have to get on a waiver.
You are entitled to have an assessment. That's it. That's it. And if you're not functionally eligible on an assessment, you're not entitled to anything. If you are wanting a waiver, you have to be functionally eligible on the assessment, and you have to meet the federal definition of disability and meet the financial criteria. So enrollment in DDA doesn't mean that you get a service. And I think that's a super misunderstood thing out there in the world. Enrollment means Washington State says you are a person with developmental disabilities. If you happen to already be on the Medicaid program, that comes with additional benefits. You will now qualify for the early periodic screening and determination if you're under the age of 21, which means Medicaid insurance has to cover more things. If you're an adult on Medicaid and enrolled with DDA, it gives you access to those dental services and the extra checkups that regular folks on Medicaid do not get access to. It gives you access to the Healthcare for Workers with Disabilities program if you're wanting to work and you make too much income to qualify for SSI or Medicaid. You can maintain your Medicaid through Healthcare for Workers with Disabilities. Gives people access to the ARCS Trust Fund so that they can shelter and protect savings for their loved ones. And it gives people access to some parks passes and now benefits planning through Benefits U with WISE. And once they're over the age of 14, so that they could get assistance to look at their Social Security benefits, figure out what they can apply for and what they'll qualify for once they apply for supplemental security income. Any questions about that? Okay. So we will help people gather documentation if needed. If they're on the consent form, we're going to send those consent forms to everyone they list and try to get records back. If it's 60 days, we've got nothing back, we're going to be like, hey, family, we have tried. They are not returning records to us. And so now you need to go get them. you need to go ask. It's the responsibility of the applicant to produce the records of their disability for a determination. And if they don't, we will send them a denial pan because we did not have sufficient evidence to find any of the conditions in our rule. We're looking for that state residency, which is you have a Washington State address on your application, that they have a qualifying condition, that it happened before age 18, and that it results in the substantial limitations the state requires. We will make a decision 30 days from receiving the last piece of requested documentation. So if I have a diagnostic evaluation and an adaptive score come in with the application, I can make a decision, a determination within 30 days. If I don't have documentation, it takes significantly longer. We'll work for up to 90 days with people who are actively working with us to try and get documentation. If they're not sort of engaged in having that conversation with us, we're going to send a denial at 90 days if we have insufficient records. Any questions about the timelines? I do always, with an active working with me family, encourage my staff to staff those with me and go longer than 90 days. So required documentation, I think I've kind of talked about that ad nauseum. It's all on that pretty chart. You'll get this PowerPoint after the meeting today. You can have all the links and lovely things. The WACs are in the corner. So if you like to get into the policy, you can. This is the list of our qualifying conditions. One of the things that changed with this rule is that now everyone can be eligible under every condition from age birth all the way through end of life. The only condition that cuts off is developmental delay. So one area of delay lasts until age 4. 3 areas of delay or more last until age 20. The big difference is we used to just do reviews here that were extendable and had appeal rights. And now people who are eligible under developmental delay will expire on their 20th birthday. So I listed out each diagnosis and the criteria a little bit more big in these slides. I'm not going to go through it again because we kind of talked about it already. But this is the criteria and the relevant WACs for each of the conditions. So intellectual disability, the autism spectrum disorder, we did expand the number of people who we would accept a diagnosis from in this new rule. So as long as folks are identified as a Center of Excellence provider on the Department of Health's list, or they're associated with a Center of Excellence or a developmental center or an autism center, we will accept diagnoses from naturopathic physicians, ARNPs, PAs, because we recognize there wasn't enough psychiatrists, psychologists, neurologists, and developmental behavioral pediatricians to be able to do this without those supporting folks. Expectation is that these other folks, if they're working in one of those spaces, do have oversight by a Center of Excellence trained provider or one of the qualified providers that's always been in the rule. For developmental delay, one area of delay is under age 3, 3 areas of delay over anytime. Really, anytime now. There's no rule, like you don't have to be 3 years one day to apply anymore. If you have a condition and a qualifying composite score, you have 3 areas of delay at 2.5, you can reapply and we will make you eligible under the 3 areas and you won't expire on your 4th birthday. So if we have one of those lifelong conditions and the evidence for it at any age, that will eliminate that 4-year-old expiration for folks. So if you have little ones, they get an autism diagnosis, they have a qualifying composite score, that will keep them eligible without expiration for age 4, which is exciting. That's a big, good change. It'll allow birth to 3 providers and family resource coordinators to help those folks who have an identified disability that will be long-term apply earlier and not lose eligibility. Any questions about that developmental delay category? We take a lot of tests for this. I know for the composite score for our lifelong conditions, we have a really limited list of adaptives. With developmental delay, I think there's like 97 approved tests that look at different parts of those 5 areas of delay. And so we'll take, like, if a PT did a gross motor and got a 25% delay on a gross motor test, if it produced a standard score, we'll accept that. And then someone else over here did a social emotional behavioral test and they got a score of 25% or below, we'll also accept that. And then a third person over here did a speech eval and they have a receptive communication delay of 25% or more, we'll accept that. And the 3 together will equal eligible under developmental delay. So this is a big, broad, wide category. And we could potentially see a lot of developmental tests like from the ESD, right? That are done by their specialists that would help people find eligibility categories. So I did do this training with them 2 weeks ago too. So these are the substantial limitation scores required for those composite tests. Those have to be within the last 36 months. And then we do still look at the impact of unrelated injury or illness on adaptive functioning. So one of the things that we're looking for if people have like clearly documented mental health, mental illness, behavioral problems, or illnesses and injuries. I always use diabetes as an example, and they're refusing medication, they're refusing to participate in treatment, and they're unstable. We cannot offer an adaptive because we have to be able to show that our adaptive test is a result of the developmental disability and not some other condition that's impacting their adaptive functioning. So what we're looking for these is someone who is a treating professional to say that they are actively in treatment and stable. So a lot of times the kid who's going into a comprehensive mental health setting is not going to qualify for DDA because we can't get a solid adaptive score for them. But on their way out, when they've reached stability, that's the time to offer an ICAP and see that, get that adaptive functioning, because we're assuming that they've reached some stability in order to be able to exit that program. So for cerebral palsy, again, this is not an adaptive score requirement. We just need to show the need for direct physical assistance daily with 2 of these areas. We expire at age 4 and age 20 if your category is under developmental delay. And we do a review for everyone at age 19 if the last determination was before the age of 16. So if you became eligible with autism and a qualifying composite score 16 years and 5 days, you'll never have a review unless you move out of the state and come back under the current rule. So for 16 and over, we don't do a review at age 19. If we made that determination after the 16th birthday, they don't have the adult review. They won't get the letter and they won't have to do that process. Any questions about that? So the only time we terminate is if the client or their authorized representative tells us they don't want to be a client of DDA. All of our services, including enrollment, are voluntary. Or if they leave the state of Washington, no longer reside here, then we'll send what's called an out-of-state notice and terminate all their services. Here is the application support information in multiple languages. This is also on our website. So if you go to the main DDA web page, all the documentation is there. And all of this information in all these multiple languages are there. There's a step-by-step. Here's what you do first. Here's what you do next on that page. And it's translated into all of these languages for you. This is some numbers of people served from the 2023 caseload and cost reports. Total number of clients at that time was 54,000. We have 30 employees. I have 10, technically. I have 7.5 because my birth to 3 case managers are also assessors half-time. who do intake and eligibility applications and process these. We have one supervisor in our region, that's me, and then we have a program manager named Kat and a staff psychologist named Dr. Thomas. We make about 89% of people eligible for enrollment. This includes birth to 3 numbers, so I always say that as a caveat. They're very easy to make eligible. Pretty much anybody who applies through the early intervention evaluation is going to enroll. So slightly skewed, but I would say last year we made 97 people per month on an average eligible in Region 3. For the number of applications that come in, you can see the total number kind of took a dip during the pandemic, like all things, and we're back up significantly past pre-pandemic numbers by 1,000 applications a year. Just in 2023, I anticipate that number will be much higher on our next report. So this was the name of the 2 pieces of legislation that fundamentally changed our rules. Here's some resources, our main web pages, the contacts for our staff psychologists if you have assessors who have very specific clinical questions, our program manager, Kat, who's in charge of policy, and Rose Spidell, who's our educational liaison if you're struggling with OSPI, evaluation, support, things like that for a DD enrolled client. And then Region 3 is where you would send all your information. I have a staff who's on call every day, Monday through Friday, 9 to 5, to answer intake specific questions at this number. So there's always somebody available who is an intake specialist if this is the number people call. Or they can send questions to this email address and they're sent to the worker of the day. So after someone is enrolled, like, yay, you're enrolled, doesn't mean you get anything. Have to go ahead and request an assessment. So if families pick up the phone for us to tell them about their planned action notice and give them the state recovery statement and talk to them about their rights to appeal, we will also ask them if they would like an assessment. If they would, my staff will fill out the assessment request form for them right there on the spot on the phone. What we find is that most of them don't pick up the phone for us, which is sort of a bummer because then it depends on them asking for the service assessments. They do get a little welcome letter. I can show you what one of those look like because I always feel like it's cool to show people. So once someone is found eligible, they get this letter that says, welcome, you are now enrolled. Review information. You have a planned action notice in this envelope. You've got estate recovery information. There's program and services info you can grab at this website. If you would like to get a service, go to this site and request a service, or email one of these emails if you have questions, or call the service and information request number for your county. And we have folks answering the phones, answering questions about assessment, or taking people onto the service and information request list from those numbers. Jan. I don't hear you. Am I the only one that doesn't hear her?
I don't hear her
her
either.
You want to put your thought or question into chat?
My microphone. Can you hear me now?
Oh, yes, I can. Got you. Okay.
Microphone got changed. This step right here is a huge confusion. Is there any thought about changing it to be a little more enabling for our families to get that assessment. I think that's the confusion is they get the letter, they say they're enrolled. Great, my child's enrolled. Now they sit and wait. And I hear that they don't answer the phone, but I don't think it's a clear, they truly understand that they need that assessment to get the services. They think that they got eligible, so now they're just waiting for services. Like, and I don't know how to make that clear, but that's the sticky spot right there.
Yeah, I don't know how to make that clearer either. Because if they don't pick up the phone for the conversation, then this letter was the answer to like, you still gotta call or go online to ask for services. Like you can't, you're eligible, you're enrolled, but that doesn't mean you get services. You have to call or email to go request them.
And request an assessment, which that's confusing because they've already went through all the rigmarole or documentation.
Yeah, so the nature of the CMS program is that everything is voluntary. So we can't automatically assume anyone wants anything. Some people enroll just because they want a dental benefit. Many people enroll because they don't want to have to worry about it later when they might need it, but they don't actually want a personal care representative in their home right now. We can't make an assumption everybody wants an assessment. And so we do have to have them actively request a service.
If it's okay, I'm gonna chime in. I think where families are getting confused, and I for sure was getting confused as a professional, is with so many of the ICAPs happening. People were thinking that that was their like intake assessment, and then they're just like
Cool.
waiting on services.
Okay. Yeah, no, that is very good information. I think they get a packet of information explaining that that is an adaptive assessment for enrollment, but I can see how they might get confused, especially if they've never engaged with our process before.
Yeah,
I'll
and
have a
so when
conversation
they're
with my staff about the language that they use around ICAP and ensuring people understand that it's not an assessment for services. That's really good feedback, Patty.
yeah, because when they're calling us on the back end, they're like, I had an assessment with DDA. Now what do I do? And we're like, well, I mean, I'm not sure.
Yeah. And we specifically call it an interview to try and avoid assessment language. But I will definitely think about how I can make that more clear. Like this is not have them make a statement. Like this is not an assessment for services. This is to determine whether or not you can enroll. Yeah, I'll bring that to the statewide team too, because I'm sure we're not the only people experiencing that. The planned action notice, if I had a say, would look different, but it's very legal. It's a very it's a very legal document. It's written by attorneys. It has whack language in it. It always has an appeal right in it, which people fill out because they don't understand that that's not paperwork to fill out. I don't know how to make that less confusing for folks. So we've tried to put additional supplemental information like the welcome letter instead, to make that more of the focus. We also include the life course resources toolkit from Informing Families with every planned action notice determination. It kind of walks them through services and programs, directs them to Informing Families, points them to local resources. So these are things that we include in every eligibility determination planned action notice envelope. If they're under age 3, they also get the specific information about the early childhood transition and what our role at DDA is in that program. And if they are over 18, we give them the Employment Services for Adults with Disabilities flyer as well to help them get more information about disability employment options. And then we send a home and community-based waivers brochure with everyone. So that's some of the materials people get when they get enrollment. And then there's a couple different ways that this can happen. If a person requests entitlement services and they're already on a Medicaid Apple Health program, and my staff look at that on enrollment applications, they see, is this person in ACEs? Are they already on a health plan? If they are, we say to them, hey, we have all the documentation to make you eligible within that 30 days, and then we send them forward for assessment planning. If they are not eligible, we offer them the opportunity for assessment anyway, because we do assessment for children under the age of 18 who are not DD enrolled, but are on a Medicaid state plan. And so if they have personal care service needs, even if they aren't DDA enrollable, we can still offer an assessment for long-term care, which is just personal care services. They won't be able to access a waiver or any of those other enhancement programs, but that is available through our specialized unit at DDA. If they're over the age of 18, we include in our planned action notice and information a referral to the Home and Community Services line for their area to request personal care service assessment through the adult programs at Home and Community Services. So that's part of the planned action notice and conversation for people who are not eligible or enrolled, or who we do not have enough documentation for and that it's taking time. We might also refer them to the specialized unit or to Home and Community Services for assessment. So they can get in line, is what I call it, get in line for an assessment. If they are determined eligible, then they request a service. They're assigned to a case manager to conduct an assessment. That varies wildly depending on where you live. So Clark County, Pierce County, significantly more people live there. We don't get new case managers for every enrolled person. We're not funded for every enrolled person. And so capacity for assessment depends on how many people asked ahead of you and how much case management capacity exists within your office. So there's potential someone out in Mason County might get an assessment way before someone in Clark County or Pierce County because their case management team has capacity to do it sooner. So a person that does not need services is assigned to the no paid services caseload. Currently, they would get a call once a year to ask if they needed anything, how things are going, they'd want assessment or service. I don't know what's going to happen with that after this legislative session, but that's the current practice. If anyone from the MPS caseload requests a service, they go back into the same queue as everyone else who's asked for an assessment. Any questions about that process? All right. So then we do a care assessment. That's the 170 questions, multiple hours to help people who are interested in personal care and waiver programs to determine functional eligibility. And then people can request from there a waiver program. Those are currently competitive. What that means is we have cap funded waiver spots, unlike COPES and some other programs. Those are entitlements positions. So if you federally and financially qualify, there's a spot for every person who federally and financially qualifies. DDA is cap funded, so we're only given a certain amount of funding. And so we have enough spots for the funding that is allocated from the legislature. So that means you could request a waiver and be told no. If that happens, then you go into a database that we share with the legislature to say this many people have requested and not been able to access it, and it helps us to advocate for more funding. Here's some links and resources that are my favorites, including this new Home and Community-Based Service Waivers services videos that are available on the DSHS YouTube. There's also a new how to enroll video. It's a 2-part series, 6 minutes total. Step 1 talks about the process I just talked about enrollment. And then the step 2 video walks people through requesting a service assessment. And that's all I've got. Just under an hour.
Thank you.
Yeah.